but even young adults, women who are recently married, they say even after one child, if you have it, it still helps you.
Okay.
So I mean that is off the track, but that's one thing I would like a lot of you to know, because I'm sure
there are a lot of questions around
have
that.
young daughters, and it is one of the things. Some of the countries it has become part of their vaccination program. You know, like how we have our diphtheria, measles, and all the blah blah which we get our kids done. So there in schools, it is part of their normal vaccination program. In India, it's not part of our program yet, but maybe in times to come it would be. But all educated mothers and aware mothers are all coming up and getting their daughters vaccinated, which I think is the right thing to do.
Any downside to this vaccination, ma'am?
As of now, there haven't been any studies to show that it has any side effects. The little side effect is that, you know, like that of a tetanus, mild pain in the arms, a little bit of fever, but nothing major. Nothing much.
Is there any question around this? Yeah, please.
I believe the efficacy of this vaccination, of the cervical cancer preventive vaccination, goes down with age.
Yes.
So we all in our 40s, if we are sexually active, is it appropriate to take a vaccination now, and would it really help at our age?
I would say at 40 it would not really, because you've had a lot of sexual activity already. Now this is a vaccine against a certain virus, which is one of the factors which could be responsible for cervical cancer. Now the thing about this virus is that in a normal individual with a normal immune system, this virus will get eliminated on its own.
Right.
And in due course, you develop a kind of an immunity.
Antibodies.
Those people who don't develop the immunity are the ones who are more prone to develop cervical cancers. And this vaccination helps them much more than people with, you know, normal regular immunity. And by a certain age, you have acquired the infection already, and you have also acquired the immunity.
Right.
So at about 40, I don't know. I don't think it really is very
beneficial. Okay.
While can I continue? Can I ask something more leading to this?
Briefly, please.
I had my sons going to the US to study, and I was a little concerned regarding if at all they would indulge in sexual activity over there, because they were grown-up adults. So I consulted my gynecologist, and she suggested a vaccination for the boys also prior to sexual activity. Is this something which is there really for boys as well?
It's not really being used very much for the men. But yes, you see that human papillomavirus is a virus which is sexually transmitted.
Right.
So, but it, you know, for one reason, penile cancers are much less common than cervical cancers. So yes, if the person is vaccinated, he would not transfer it to the female partner.
Would he not get it either? He would not get it either from his sexual partner.
He wouldn't get it.
He would not catch the infection either.
Yeah. But you see, the point is, usually in men, it doesn't give them much of a problem. It's a rare, very, very rare infection.
So,
it's not common.
So I think that's pretty clear on the pap smear and the vaccination. I would move to Dr. Akhilesh Srivastava.
Just briefly.
Yeah.
I wanted to know about hormone replacement. You are absolutely right, not premenopausal as well. Is it good, or can it be avoided, or should it be avoided?
My question is regarding HRT. So,
no, that's fine. It's just regarding HRT. Is it actually good enough to take it, or should one avoid it?
should we
see, HRT should be taken when it is indicated. There was a time when HRT was given to all and sundry, irrespective of whether a person needed it or didn't need it. But that's not the thought anymore. HRT is a very good thing, definitely to be taken when it is indicated. Now the next question would be,
when is it indicated?
It would be indicated. You see, the first things that start off are the hot flushes, the palpitation, the sleeplessness, the vaginal dryness, all these. So if these things are making your life intolerable, if you're in the middle of a meeting and you break into this sweat and palpitation and you don't know how to cope with
But
it.
ma'am, would you not be considering this like an overreaction? I mean, you can go through the hot flashes for a few
No, to what extent? If it is interfering with your day-to-day activity, if it is holding you back from doing things that you would normally be doing,
Would
then
the first
definitely
step
go
be
for it.
diet? Would the first step be exercise and lifestyle changes before you move to HRT? Because there would be a downside to HRT as well.
There is a downside to HRT, but then I'm sure that people who are really getting it, they can get into diet and this thing, but that should be as a kind of supplement and as an aid to it, and then subsequently they can stop the HRT and remain with yoga, diet, exercise and things. But to begin with, when it starts off, it makes some women so very uncomfortable that just the diet and just the yoga and exercise may not be enough.
So what you're saying is the severity of symptoms would determine symptoms. That's it.
Severity of symptoms.
So you
Very
could
indicated.
perhaps try lifestyle changes, and if they don't work, then look at HRT as an option if it's interfering in your life. Yeah? And there are, of course, the downsides of HRT,
That's right.
which we would obviously, yeah. And it is known to increase the risk of cancer. Yeah. Dr. Srivastava, your turn. Tell us what these women in our age group, what should we be doing to protect our hearts? That is his area. He is a cardiologist and deals with issues regarding the heart and metabolism.
So, as the life starts at 40 for ladies because they have more time to themselves, their children are settled or getting settled, and unfortunately in India, in our society, ladies are always working for others and not for themselves. They are sacrificing their time, their frustrations for their in-laws, for their children.
Not usually acknowledged.
For the children, and they don't look after themselves actually. They are hardly looking after themselves. That's why the heart conditions are not diagnosed so frequently in ladies. Although they might have it, but because they have never been to the doctor and they have never complained about their symptoms. They are more worried about symptoms of their husband. They are not worried about their own symptoms. So at 40, as Dr. Bela was saying, some hormonal changes start. Estrogen levels fall, and fall in estrogen levels is directly related to coronary heart disease. Anybody who's it's very simple, after menopause, the incidence of heart disease is same in male and female.
So we are a protected lot
Yeah.
until we hit menopause.
Yeah.
But then we have the equal risk post
Yeah,
menopause.
we have equal risk. But what happens after the age of 40, some estrogen level has started falling. So at that time your risk increases. And what should you be doing? Getting a preventive checkup done. Because that is the best way to find out if there is any impending problem which is going to come up in near future.
Can I just pause and say, are there any particular groups where...
I was going to say that only.
Okay.
If there is a family history means your parents, your grandparents, and your siblings, and first cousins, or like father's first cousin, mother's first cousins. So if there is a family history, then you should start getting checkup done at least 10 years before your mother got it or before your father got it. Suppose your father had a heart problem at the age of 50, then it's better that you go for a checkup at the age of 40. Or your mother had any problem at 50, you should get it done at 40. So these would be the special groups. Other.
So can I just pause?
Yeah.
What problems are we referring to? Just heart disease? I would add diabetes.
I'm going to say that because other problems which you have to look out for are majorly 3 or 4. One is diabetes, other is high blood pressure and high cholesterol. These 3 must be checked every year without fail.
And if you have a family history of any of these,
And
then you
before
go
that.
10 years ahead.
So at the age of 40, you must undergo lipid profile check, that is cholesterol and all, blood pressure of course, and diabetes. And if there is a overweight problem, I don't see many overweights here, that's a very good sign. It is so fantastic because obesity is the biggest problem in Western countries and in India also. So if you have weight problem, obesity, then of course you have to go for the checkup before 40 also, maybe at the age of 35 or 30 also, if somebody has a very, unusual weight problem, then you must.
Can I just add a comment here? Of course, the BMI is very important, which is an indicator of your weight.
I'll just explain. I'll just explain. If you mean to say something.
No, I was just saying that it's also the waist measurement.
Yes.
So it's your BMI and your girth, both which are important. So watch both, and there are guidelines for both.
I will tell you the guidelines. What is BMI? It is called body mass index, which is calculated by your height and weight, and it's a very simple formula. Everybody can do that. So BMI, normal BMI is from 18 to 24. Okay, if you fall in that bracket, you don't have a weight problem. Below 18, of course, is underweight. I don't see anybody below 18 here. Above 25 to 29 is called overweight, and from 30 onwards it is obesity. From 30 to 40 it is obesity, and above 40 is extreme obesity, where it is called morbid obesity also. And like waist circumference for ladies, it should not be more than 34.
And let me add here, these are WHO guidelines. For the South Asians, they are
they are even lower because we are not so big built like Western people, and for Western people 40 inches for men, but for ladies it is 34 inches. So in Indian context you can say it is 32 inches.
90 centimeters for men and 80 centimeters for women. Less than that.
23.
And the BMI of 23.
Yes.
The weight in kgs.
It is weight divided by height square.
Meter square.
Meter square. Yeah.
Okay, there are a lot of questions here. Can you?
Yes.
Yeah.
Can I, Dr. Khosla, can I address a question to Dr. Srivastava?
Yes, please.
Dr. Srivastava, we were talking, I understand you're a cardiologist, and I do suffer high cholesterol levels, which I try to, maintain with exercise and yoga. Tell me, how do we manage cholesterol up to some extent with lifestyle changes, if I want to avoid taking medication?
Okay. So there are only 3 methods by which you can control your cholesterol. 3 non-medical methods. One is your weight, which is very important. If you lose 10 kg of weight, I am not saying you, if somebody loses 10 kg of weight, his or her LDL cholesterol is going to drop by at least 20 to 30 milligrams. Okay, 20 to 30 degrees. So one is weight, another is exercise, which is minimum guideline is 40 to 45 minutes of brisk walk, not very vigorous exercise, not required. Brisk walk for 40 minutes at least 5 days a week. But if there are some additional problems, I am a little digressing. If somebody has a history of breast cancer in the family, or colon cancer in the family, or obesity in the family, then you must walk for 1 hour and every day of the week. Okay? So one is weight, second is exercise, and third is of course diet.
My issue over here is that I have a genetic history of high cholesterol. So no matter how much I try to maintain my cholesterol,
I'll give you the number. Yeah.
Then you need to seek his advice professionally.
No, but I'll give you the number at which number you should be taking medicine. If your total cholesterol is more than 230 or 240, in ladies I am saying, for men it is lower. And if your LDL is above 140, then you definitely need medicine.
Yeah, your question.
Just to find out about stenosis,
Okay.
And what would be the first symptoms, first and foremost, because even if a lean person can have stenosis, it kind of scares you.
Yeah.
So I just wanted to find a little guideline that how do we all prevent. Because like you said, that we, like for a person like me who's already in her late 50s, it's very important to keep your heart conditions in order. So the first thing which occurs in my mind is of course the cholesterol level, which is normally will increase at this age. I don't think it definitely increases with age. And also how to prevent stenosis. Thank you.
Well, just define the word stenosis for the rest of the audience.
She's meaning coronary stenosis.
Yeah, so you just explain the word.
Yeah,
the term
coronary stenosis means blockage in the arteries of the heart.
Any kind of blockage.
Arteries of the heart which supply blood to the heart. Because heart also needs blood for its oxygen, for its movement, because heart is a muscle only, so it is pumping all the time, so it is beating all the time throughout your life.
And the blockage also can happen in any part, I mean,
Yes.
coronary or brain or any artery
anywhere.
supplying also,
But
the limbs, anything.
Yeah, all right.
Yeah.
Specifically, she.
But the guidelines are the
talking
same.
about
Yeah.
it's same.
Yeah.
So, what are the causes of stenosis? First of all, we should know. One important cause would be genetic, that is family history. If there is a family history, you are bound to get some stenosis. Okay. It depends at what age the family member started a heart problem, like your mother or father. So you should be careful at that age and before that, actually 10 years before that. Now, other causes are smoking, which is very important. There are some modifiable causes and some non-modifiable. So non-modifiable would be age and family history. Okay, and gender. Gender means males have more coronary stenosis than females. But I'll tell you later, females have some bigger problem. Okay, these are three modifiable factors. Then other factors would be high cholesterol, high blood pressure, diabetes, smoking. These all can be avoided or they can be at least toned down. Okay, and of course obesity. So 5 factors are there. Now, how would you come to know that you are developing some stenosis? Everybody usually gets some stenosis by the age of 30. But stenosis, if it is not more than 70%, usually it will not cause any symptom to you. Okay?
So you don't have to get panicked when somebody says 70% block. It means
So
it's 30%
you don't have to panic,
Yeah.
but how would you come to know is by symptoms. And symptoms are always exertional. You will never get any symptom while you are sitting and relaxing. They are always exertional. So if you are walking on the treadmill, you are doing some exercise, and if you feel any symptom in the chest, which I am going to describe, because ladies' symptoms are different from men's symptoms. Okay, so you should be careful. If you get any symptom on exertion, that is the first indication of stenosis, and that is the time when you must go for a proper checkup.
What about emotional stress, Jill? That is also?
That also adds physical exertion and emotional exertion also. Stress can also bring on your chest symptom. What are the symptoms? Usually it's just pain, of course, but you may just feel some heaviness in the chest, nothing else. Okay? And ladies' symptoms are a little more different than men. As I told you initially, you can feel only indigestion. Indigestion. You can feel only nausea. Or you can have back pain in the upper part, upper back pain. And there
Please
may not
listen to
be
this very, very carefully, because these are
there
not
may
really
not
talked about.
be any chest pain in front. There may be only a back pain. And nausea, vomiting also. Some ladies get vomiting also. They would say, oh, kuch nahi, indigestion ho gaya, theek ho jayega.
And antacid
So,
is popped in.
and they just pop up antacids
Does
and
this
all.
also hold good for a diabetic patient? Or is
Diabetic patients, of course, because diabetic patients usually don't get any pain. So they don't get any chest pain. So these subtle symptoms are more important. Because in diabetic patients, why don't they get any pain? Because their nerves are there is neuropathy, that means nerves are not working very well. So you don't get any pain. So you have to be very cautious. If you feel just tightness in the chest, just as if somebody has put a weight on your chest, or somebody is squeezing you, any kind of this symptom can be a heart symptom. I'm not saying all symptoms are heart symptoms. But you have to be, yes, breathlessness, of course, breathlessness on exertion.
But so obviously these symptoms are normal acidity or normal kind of this indigestion feeling should not be taken into account. It should only be during activity, post-activity.
Usually on exertion.
So you don't have to panic each time you have an indigestion issue.
Suppose you've gone for a walk and you feel this.
Then yes, absolutely.
The most important symptom would be while walking that you want to stop by any kind of symptom.
Any challenge to your body.
You want to stop, let me sit down, and after 2 minutes you think, oh, I can walk again. That is first symptom.
I just wanted to ask you a question. They talk about you had a clot in the brain.
Yes.
You don't get a symptom, and not necessarily every clot in the brain leads to a paralysis.
Right.
But still, you can black out or not. Are there any symptoms
Or
precautions which can actually let you know about that?
Okay. See, if the clot is very small, it is like a microscopic clot, it may just pass off without giving you any symptom. The clot, when it gets detached from its original site, it can travel to the brain, or it can travel to the heart, or anywhere. So if it goes into the brain, body has its own self-defense mechanism where it dissolves the clot. If the clot is very small, you may not get any symptom. But if the clot is not so small, then it would definitely cause some symptoms. Sometimes body takes little time to dissolve the clot, and that will give you some symptom, which is called transient ischemic attack. You will have some transient weakness in the arm or any part of the body, or you can get some transient vision disturbance, and it will vanish after some time.
It's commonly known as a TIA.
So by then the clot has dissolved and has passed off. So you don't get anything. But if the clot is big enough to block an artery completely, 100%, then you're going to get a paralysis attack or some speech disturbance or anything. You will get a proper stroke. So for this, what you have to do, if there is a family history, then you need to take some anti-platelet medicine, that is lactulose.
We do have lots of questions coming in.
Ask me a question.
We will take these specific questions around the cardiac health a little later. We have Dr. Monisha here. Dr. Monisha is, as she's been introduced, makes you beautiful outside. And what are the common things that you are finding your women are worried about today? I think it's a sea change in our approach to beauty and our personality. So what are you seeing most as affecting women, and what are your procedures that you are doing, and how safe are they?
Thank you.
Why don't you move?
Okay. See, the thing you shared to the audience, to us, I think everybody is very familiar with it. At 40, no doubt life is great. Why it's great? Because you know you have that authority over everybody. You, instead of a taker, you are a giver now. Like you are giving to your child, to your husband who's the second baby in the house. Your parents, you're taking care of them, your in-laws. You feel that you have a pivotal role in the house. You're the key to the house. That sense of authority, you're ready to appreciate at 40. But at 40, what comes, another package comes with you. What is that? You look into the mirror, you see, oh, I look the same. Nothing has changed over the years. But suddenly you see your pictures. You see, where are these lines coming from? Where are these dark circles coming from? Why I'm buying jeans from 28 to 30 to 32? I'm eating the same food. I'm going regularly to the gym. What is happening to me? And believe me, I see many patients of this problem in my clinic. And I don't feel
that they are eating too much or exercising less. Because I'm going through the same thing. I used to fit into 26, now it's problem for me to put on 28 jeans. So this is happening to everyone. Why is this happening? We should know that. As we age...
I have just booked my appointment with her.
Okay, so so after, like, as we age, after 35, there's a term called as BMR. It's called as a basal metabolic rate. As we advance, this rate decreases. What exactly is BMR? BMR is the energy we spend doing day-to-day tasks. So when it decreases, that means our body is not able to burn the fat that is in our body. So as we advance, we need less number of calories because our BMR has decreased. We need to work out more to increase that BMR. So to supplement, we are eating the same diet, we are exercising, but if you see the BMR has decreased, so you have to compensate it by exercising and taking a proper diet. What diet? She'll be able to guide you better. There are foods that increase the BMR. You have to consult her, what are the foods that will increase my BMR? I'm working, I'm eating the same food, why am I gaining weight? So these are the primary concerns. Then let's come to the other package that we come at 40. The dyschromia over the face, she asked for the same thing. So what are dyschromias? These are hyperpigmentation over the face, under eye dark circles. Why this happens? This happens at 40 because of the constant exposure to the sun. We as Indians are not used to using sun protection at all. So we think sun protection, okay, we are going to the beach, then we have to buy. We don't have to use it regularly. Why?
But what about my vitamin D?
No, you see, vitamin D, face is just 9% of your body surface area, right? And what you're bothered in the morning looking at your face, where does this hyperpigmentation come? You don't look at your hands, arms or legs. You look at your face. So if you apply that sunscreen on your face, you are not doing anything to bar the sunlight to be vitamin D deficit.
Yeah, but I have a question here for myself, for instance. I have been told to use these sunscreens for forever.
Yeah.
And I just don't like anything on my face. I don't use anything except that.
Okay.
And is that something which happens to other women? I don't like the greasiness on my face. And therefore I don't use it. And there is aloe any good?
Okay. See, you said you don't like anything greasy on your face.
But there are
right?
water-based ones, even those I don't.
So there are very good brands that are good for oily skin. Beautiful brands. You use them, it will be as good as you are not wearing anything on your face. Your skin would be breathing. It won't be clogged with the sunscreen.
That's the feeling I get always applying.
Pardon? Oh, they're like Ansola, Bioderma, these are all French and German brands, but it depends what skin type you are. You can't gauge that by yourself. So you have to go to the doctor, get a skin analysis done. Doctor, what is my skin type? Do I have oily skin? Do I have a combination skin? Do I have a dry skin? What sunscreen is suitable for my face? If you have oily skin, I don't think so any doctor is going to prescribe you a greasy stuff to be applied on your face. You know, you'll die out in the sun with a greasy thing dripping off your face. So,
I have a question here.
Yeah.
You know, my grandmother, both sides, they had a flawless skin. And they never used any of
This is the question which I want to be answered. Absolutely.
Yeah, I did not finish after the sunlight, you know. It's sunlight plays a small part. So you look at the stress as like we are career women, and the kind of, I'm sure they must be having their part of stress, your grandmother and that era woman. But we are career women. We have a family to look after. We are multitasking. We are juggling in a city. The pace is so fast than what